We're going to take a really easy test before we do anything else today. You will see a vivid picture of your leg's current blood circulation in 30 seconds. Honest responses only, no gear, no standing, no special attire. It is more important than you might believe if you are over 60 and your legs ever feel cold, bloated, heavy, or exhausted. You have the best chance of improving blood flow before more serious issues arise when you recognize these little symptoms, which are frequently early clues that circulation is slowing. You are starting with a perfect score of 5 points. I am going to describe 5 common symptoms. For each one that applies to you, subtract 1 point. At the end, you will know exactly where you stand. Make sure to watch until the end, because the number 1 exercise activates what cardiologists often call your second heart, and most seniors are not using it correctly. This simple movement can significantly improve circulation when performed properly and consistently. Let us begin the 30-second leg circulation test. You start with 5 points. Number 1, do your feet or toes feel cold even when the room is warm? If yes, subtract 1 point. Cold feet often mean blood is struggling to complete the full journey down and back from your toes. When circulation slows, warm blood from your core does not reach the extremities efficiently, and the feet are usually the first place this becomes noticeable. Number 2, do your legs feel heavy or unusually tired by the end of a normal day, not after a long hike, just after sitting, light chores, or regular activity? If yes, subtract 1 point. That heaviness is often blood and fluid pooling in the lower legs because the return flow has slowed. When blood lingers in the lower limbs, pressure builds inside the veins, and that pressure creates the sensation of fatigue and weight. Number 3, do you notice swelling around your ankles in the evening? Maybe your socks leave deep marks. Maybe your shoes feel tighter at night than in the morning. If yes, subtract 1 point. This type of swelling often develops when fluid leaks from blood vessels into surrounding tissue. It is commonly linked to reduced circulation and prolonged sitting. Fourth, do you experience abrupt awakenings during the night due to calf cramps? If so, deduct 1 point. Since oxygen travels through your blood, cramps frequently result from muscles not getting a steady supply of oxygen. Muscles are more likely to suddenly contract when circulation is diminished, particularly during sleep when movement is restricted. Number 5, have you developed spider veins or varicose veins that were not there a few years ago? If yes, subtract your final point. These visible veins form when blood is not moving efficiently upward and begins to collect in surface veins, causing them to enlarge over time. Now look at your number. If you scored 5, your circulation is strong. These exercises will help keep it that way. If you scored 3 or 4, your body is sending early signals. This is the perfect time to act, because small improvements now can prevent bigger circulation problems later. If you scored 2 or lower, please do not feel discouraged. Be encouraged, because circulation is highly responsive to movement, and improvement can happen quickly when you activate the muscles that help pump blood upward. Pause the video and write your score in the comments. How old are you? Where are you watching from? And do you notice heaviness or swelling in your legs at night? Comment below so we can track your progress together. Save your number. We are coming back to it. 60 seconds of science now. Give me a minute to explain what's going on inside your legs before we start the exercises. Your heart readily pumps blood down to your legs. That part is aided by gravity. Getting blood back up toward your heart is the challenging part. There are small one-way valves inside the veins of your legs. They are responsible for preventing blood from falling backward. These valves are powerful and your leg muscles contract frequently while you're young and active, which helps pump blood upward. As we age, 2 things change. First, we sit more. Long periods in chairs, cars, or recliners mean your leg muscles are quiet for hours at a time. Second, the valves inside the veins can weaken. When that happens, blood begins to pool in the lower legs. That pooling causes swelling, heaviness, visible veins, and sometimes night cramps. Over time, this can also reduce oxygen delivery to tissues, which contributes to fatigue and slower recovery. Here is the key. The only force that actively pushes blood upward against gravity is muscle contraction. Every time your calf or thigh muscle tightens, it squeezes the deep veins inside the leg and forces blood upward. When you sit still, the pump slows. When you move with intention, the pump restarts. Research has shown that after about 30 to 60 minutes of sitting, blood flow in the main veins behind the knee can drop significantly, even in healthy adults. But just 20 seconds of calf muscle activation can restore that flow. That is powerful. The 3 exercises I am about to show you restart that natural pump without standing up. We are counting down from number 3 to number 1, and number 1 is the most important. Exercise number 3 is the seated march. This movement is simple but effective. Sit in a sturdy chair. Keep your feet flat on the floor. Sit tall but relaxed. Now lift your right knee a few inches off the seat. Place it down slowly. Lift the left knee. Place it down. You are marching in place while seated. This alternating movement activates the hip flexors and upper leg muscles, which begin pushing blood upward from the thighs. 2 details make this powerful. First, lift with intention. Do not swing your leg. Actively contract the front of your thigh. You should feel the muscle tighten. Second, lower your foot slowly and quietly. If your foot slaps the floor, you are moving too fast. A slow, controlled lowering keeps the muscle working on the way down and improves circulation more effectively. Move at a steady rhythm, about 1 lift per second. Do this for 60 seconds, roughly 30 lifts per leg. By the end, you may feel gentle warmth spreading through your thighs. That warmth is fresh, oxygenated blood reaching muscle tissue. A common mistake is leaning back and using momentum. Stay upright. Let your hip flexors and quadriceps do the work. This exercise activates the upper portion of the leg pump, but the most important pump is still coming. Exercise number 2 is leg extension with toe point. This combines the thigh pump and the calf pump in one smooth movement. Start in the same seated position, feet flat. Slowly straighten your right leg until it is comfortably extended in front of you. It does not have to be perfectly straight. Go only as far as is comfortable. Now point your toes away from you. Feel your calf tighten. Hold for 2 seconds. Then pull your toes back toward your shin. Feel the calf stretch. Now slowly bend the knee and return your foot to the floor. You just performed a full circulation flush from ankle to hip. When you extended your knee, your quadriceps squeezed the veins in your thigh. When you pointed your toes, your calf muscles squeezed the deep veins in your lower leg. When you flexed back, the veins refilled. This alternating squeeze and release helps move stagnant blood and encourages fresh circulation. Together, let's do a few. Out, point, hold, flex, and lower your right leg. Point, hold, flex, lower, and extend your left leg. Perform 10 reps on every leg. Keep your knee slightly bent if it hurts to fully stretch it. The toe tip and flex are the most crucial components. If necessary, you can even only point your toes forward and continually bring them back while keeping your feet on the ground. The calf pump is still triggered by that. Before we move to the most important exercise, let me pause for a moment. If this video is helping you understand your circulation better, please take a moment to like this video and subscribe to Senior Vital Health. It helps us reach more seniors who want to stay mobile and independent. How has your health been lately? Have you noticed heaviness or swelling improving with movement? And if you are finding value so far, you can tap the Super Thanks button below to send a small token of support. Now let us go to number 1. Exercise number 1 is the calf pump reset. This is the most important exercise in today's video. Cardiologists sometimes refer to your calf muscles as your second heart. That is not poetic language. It is mechanical truth. When your calf muscles contract, they compress deep veins and force blood upward toward the heart. When they relax, the veins refill. This pumping action is essential for preventing pooling in the lower legs and improving overall circulation. Here is how to activate it correctly. Stay seated. Keep your feet flat on the floor, knees bent at about a right angle. Now lift both heels off the ground while keeping your toes planted. Hold for 2 seconds. Slowly lower your heels back down. That is it, but form matters. When you lift your heels, imagine you are trying to press your toes into the floor. You should feel a strong tightening in the back of your lower legs. Do not bounce. Do not rush. Lift, hold, lower slowly. Let us do 15 together at a steady pace. 1. Lift, hold, lower. 2. Lift, hold, lower. Continue until you reach 15. Now rest for 5 seconds. Repeat another set of 15. If you are able, complete 3 total sets. You may begin to feel warmth spreading through your calves and even into your feet. That warmth is improved circulation. A common mistake is lifting only slightly. Try to raise your heels as high as comfortably possible. The stronger the contraction, the more powerful the pump. If balance is a concern, hold the sides of your chair for stability. If swelling is severe, begin gently. Even small contractions help. Make sure to watch until the end because I am going to show you a simple daily routine that combines these exercises into a 2-minute reset you can use every single day. The exercises are powerful, but small daily habits multiply their effect. Booster number 1 is the 20-minute rule. Every 20 to 30 minutes of sitting, activate your calves. For at least 20 seconds. That could mean heel raises, ankle pumps, or even pressing your toes into the floor repeatedly. Prolonged sitting slows venous blood flow, but even brief movement bursts restore it. Booster number 2 is ankle circles before bed. While lying down, gently rotate each ankle in large, slow circles, 10 times clockwise and 10 times counterclockwise. This keeps small ankle joints mobile and prevents stiffness that restricts circulation overnight. Booster number 3 is leg elevation. While resting on the couch or bed, place a pillow under your calves so your heels are slightly higher than your heart for 5 to 10 minutes. Gravity will assist the return of pooled blood. Do not elevate if you have been advised otherwise by your doctor, but for many seniors, this simple habit reduces evening swelling noticeably. Now let us close the loop. Remember your starting score from the test. If you practice these 3 exercises once or twice daily for 2 weeks, retake the test. Track your progress. Improvement often shows up as less evening swelling, fewer night cramps, and lighter feeling legs. Circulation is not fixed. It responds to movement. Before we wrap up, please keep in mind that this video is not medical advice and is simply meant to be instructive. Before beginning new workouts, please speak with your healthcare physician if you have been diagnosed with peripheral artery disease, a history of blood clots, severe varicose veins, heart issues, or unexplained leg pain. Seek medical attention right away if you have shortness of breath, chest pain, or abrupt swelling in one leg. Your medical background is distinct. Your doctor can help you safely because they have a complete picture of you. Today, we took a simple 30-second circulation test to assess your leg health. We learned how your calf muscles act as a second heart, helping blood fight gravity. We practiced 3 seated exercises to restart the muscle pump and restore blood flow. And we added 3 daily habits that support healthier veins and reduce pooling. This is not about intense workouts. It is about consistent, intentional movement. Your legs have carried you for decades. They deserve daily care. Thank you for investing in your mobility today. If this helped you, share it with someone who struggles with heavy or tired legs. And if you would like to learn about one simple bedtime habit that supports circulation overnight, watch the next video on your screen. Stay strong, stay moving, and I will see you in the next video.